everyone, osteology of lower limb. Today we have the hip bone. Hip bone is a fusion of three bones. Superiorly it has the ilium, antero-inferiorly you have the pubis, and posterior-inferiorly we have the ischium. All three bones are fused together at a cup-shaped hollow known as acetabulum. The ischium and pubis are divided from each other by a oval-shaped opening called the obturator foramen. Now let us look at the bony markings of each part of the bone. First of all, ilium. When we talk about ilium, it has two parts. This is the ala of the ilium or the wing of the ilium, and we have the ramus. Now, when we talk about here, we have a fossa. This is the iliac fossa, and superiorly we can see a crest here. This crest is called the iliac crest. It has the inner lip of the iliac crest and the intermediate zone of the iliac crest and the outer lip of the iliac crest. Now, when we trace this anteriorly, we can see anterior superior iliac spine, anterior, and when we come down a bit, anterior inferior iliac spine. Then let us trace this posteriorly. We have the posterior superior iliac spine and posterior inferior iliac spine. Here we have the iliac tuberosity and auricular surface for the articulation with the sacrum. Let us talk about the posterior surface. This is the gluteal surface. It has gluteal lines, that is the posterior gluteal line, anterior gluteal line and inferior gluteal line. That is all about your ilium. Next we have another thing here is the arcuate line. Arcuate line continues as the pectineal line, and here there will be sacral promontory. Now these form the pelvic brim. Pelvic brim basically divides the pelvic cavity into greater and lesser pelvis. Now when we talk about pubis, we have three parts: superior pubic ramus, inferior pubic ramus and body of the pubis. In the center we have the symphyseal surface. This is where right and left hip bones join. Then we have the ischium. When we talk about ischium, here we can see the spine of ischium. This is the greater sciatic notch, lesser sciatic notch. And then posteriorly we can see the ischial tuberosity and the ramus. Here is the ischial ramus. Here then we can see this is the inferior pubic ramus. Together they are called the ischiopubic ramus. And this one opening here is again the obturator foramen. Acetabulum, when we talk about acetabulum, this is a cup-shaped hollow. It has the lunate surface. This is the articulating part that actually articulates with the head of the femur, and then we have the non-articulating acetabular fossa, and then here we have this place is completed by ligaments. This is your acetabular notch and supraacetabular margin. That is all about your hip bone. Thank you.